and get started, we'd like to reward those that are here on time. So thank you for being here, and it'll be a very interesting evening for all of us. You've probably had a chance to already read the treatments that we have, and I'm curious to know if there's anyone here that is not a patient. Raise your hand.
I'm not, but my husband is.
Okay, well, welcome.
Thank you.
So most of you are familiar with the kind of things that we do here in hormone replacement and thyroid work, and a lot of anti-aging therapies, and all the way to chronic fatigue and fibromyalgia. So what we're going to be talking about tonight is actually supplements that help in those treatment programs. And just to introduce our providers, we have 5 providers, two MDs, and 3 nurse practitioners. Dr. Spurlock is here at our Dallas office. He's our medical director and our detective doctor. And he will be our presenter tonight. And Dr. Scott is in our Las Colinas office, and she works there with Elise Lewis. And then here we have Roxana Cocos and also Amanda Holscher. And after the program tonight, if you have questions, the staff will be here and be ready to answer your questions. Also, I think a lot of you are aware that you get 20% off of our prices of supplements tonight. So we will, after the program, you just go see Morgan and Emily in the front desk. They will be able to help you with those. And I just thought I'd give you a snapshot of the supplements that Dr. Spurlock is going to go over tonight, things that he takes. So with that, I'll turn it over to Dr. Spurlock.
A short history of me. I finished family practice residency many years ago, and I moved to Dallas in 1994. I had gotten here in July, and I was busy moving and building a house and setting up a new practice, and I didn't do my CME. So it was December, and I needed 25 hours to maintain my license, so I had to do something real fast. So I flew out to Las Vegas to a conference that was there that was anti-aging. You know, I thought it was a bunch of plastic surgeons and dermatologists, and I just thought it was going to be a blow-off conference. I got easy 25 hours and no big deal. Well, I'm not going through the full detail, but I was totally blown away. It was not at all about that. It was about really anti-aging, and it was really deep, and it messed my head up because it completely turned around what I thought about when I treated patients. Well, immediately I began to start doing that work, but I only knew un poquito at that moment, so it took me a while to figure a lot of this out, but I kept going back to the conferences and learning more and more and more, and I started adapting my practice. And in 1999, I met this lady back here in the corner with the white baseball cap, Julie, and she works for a very wonderful company of supplements that I've been using since then, and so we've been working together, and that's been 20 years now. So behind that process, I have learned a lot. My career has changed a lot in those years. And I continue to learn. And let me assure you that that will continue. I'm working about 3 or 4 research projects right now of new things I want to do. So I really have this as something that's going to be an ongoing thing with me. No, I do not take every supplement in the world. I can't. There are probably 1 million wonderful supplements. You cannot swallow them all. So that's not what I'm trying to ask you. And you don't even have to take what I'm taking. That's not the purpose of this thing. I sort of want you to know why I'm doing this. But I've learned a lot of stuff through this process of how to make this work. Is there one company that makes everything? No, and there never will be. And we don't want there to be that. That's not good. We want a little bit of variation, but I'm going to teach you a little bit tonight about, the concepts that we're going through as we're evolving with supplements and medications. And I have patients that come and say, "Oh, Dr. Spurlock, I'm taking 22 pills. I can barely choke them down." I said, "I take 50. They're beans. How many beans can you eat?" Because I only take hormones and I take nutrients. Now, I do take Valtrex. I take one for my viruses that I have, and that's the only real drug that I take. The rest of them are all hormones and nutrients. That's what I take. I don't take pills. I mean, I don't take that. So, and my issue is that we were talking earlier about amino acids. Well, that's just from your proteins that you eat, but I have a very specific protocol that I use for that. So I'm going to have to go through this sort of quickly because there's a lot of territory to cover, but I want you to understand that, no, all of y'all need to take exactly what I take? No, but I want you to understand why I take it. Now, anti-aging is a total different concept. Actually, the real term is probably not anti-aging. It's probably optimal aging, because we're all going to get older. And we're not going to live forever. We're not Methuselah, so we're not going to last forever, so we'll have to deal with that. But when you're thinking about it, is that you want to keep your body vital, physically and mentally. I did a talk for Dr. Melita Williams 2 or 3 months ago, and it's sort of a weird crowd, and I knew they weren't catching what she was trying to tell them, and they didn't know who she was. I know who she is. And they didn't get it. And she said, Dr. Spurlock, you want to say something? I said, okay. And I said, everybody in this room is suffering from exactly the same thing. Aging. Different degrees, different ages, different genetic groups, all that kind of stuff is thrown in there, but same thing. I says, what is aging? It's the loss of repair molecules. If you maintain repair molecules, you continue to repair. If you do not maintain repair molecules, you do not repair. And I made an analogy of a vintage car. Are there vintage cars on the highway that look great and run well? Yes, not many, a few. Are there antique vintage cars in the junkyard? What's the difference between those two cars? Maintenance, inside and out. I'm probably going to do another lecture on what I do for my skin. But I just want you to know that tonight we're going to do the internal stuff. But it applies to your skin, okay? So there's issues of what do you do to maintain. And it's a little hard work because but again, if you want to stay vital, you will do this. Now, I do not take estrogen. I'm a guy. Women take estrogen. Okay, well, let me explain. I know all about that. That's what I do in my practice. But my mother came to me at 58. This is very important information. Every single person in her family got Alzheimer's at 70. And every one of them went in the nursing home at 70. She was the youngest. She did not like this pattern. She said, what do I do? I said, you go on estrogen. Now, some of you ladies may have trouble taking it. We need to fix that. But some of you ladies have trouble taking it. We know that. But you need it. We guys need testosterone. It keeps you from getting Alzheimer's. It's really that simple. Now, that's just one repair molecule, of course, but it is a very important one, and I could go on for 2 or 3 hours for just those topics alone. But I just want you to understand that that's sort of what we're saying here. Okay. What's the best thing to say for your old age? They asked a group of 70-year-old CEOs, how much would it be worth to you to return you to your health of 40? And they said 97% of everything I own. And they said, why? He says, because if I had the health I had at 40, with what I know today, I could make that money back in 2 to 3 years. Your health and your brain, remember. So we're talking about antioxidants, and we've done a little thing here now. This antioxidant, of course, testing something very simply, but it has more meaning than that. And again, it's simplistic for people who are not in the medical field, but for the medical field, it means a lot more. This is a test to check your carotenoids, which is a scanner. Now, this is Star Trek technology. Star Trek. This is Dr. McCoy's tricorder. He scans you, and he says what's wrong with you. And it's not blood levels, it's tissue levels, which is what we really want to know, but we can't do that. Blood levels don't tell you that it gets in your tissue. We don't know that. So we're still a little barbaric, but we're moving. So this tells you, and this is part of your immune system. But there's 6 points to this. 1, are you ingesting the foods that contain the carotenoids, the brightly colored fruits and vegetables? Are you consuming them? Number 2, even if you are, you may not have enough, so you might need to take a multivitamin that has good vitamin A in it, which is the carotenoids. Okay? Then, is your thyroid working? Because it enhances absorption out of your gut. If you eat wheat, you block absorption out of your gut. If your gallbladder doesn't work, you don't absorb the fat-soluble vitamins. And these are fat-soluble vitamins. And then if you've got a lot of plaque in your arteries, you're not going to get that into your tissues. So that little test means a whole lot to us. Because, Julie, I don't know if you remember, but I was doing everything right, and my scores weren't coming up, and we couldn't figure out why. My gallbladder wasn't working. I've got that fixed now. So that was an issue, okay? I actually have a fifth pillar here, which is probably magnesium. It's probably something you all should take too. But a good multivitamin, a good vitamin D3, a good probiotic, and omega-3. Every human, man, woman, and child, needs these products. These are just your core products for your full health. And everyone should take those. Now remember, omega-3s are fatty oils, fish oil, flaxseed oil. You don't absorb it if your gallbladder doesn't work. So you got to remember that you got to look at these things and what's going to make it work for you. And of course we have all these regular essential vitamins. Most we take. These two here, coenzyme Q10 and magnesium, are really critical. If you came to me and had high blood pressure, I would do these two first, because they will lower your blood pressure. The coenzyme Q10 makes your heart beat more effectively, and it doesn't have to pump so hard. And magnesium relaxes all your blood vessel muscles, and so it lowers your blood pressure. Iodine not only helps you with your thyroid and thyroid hormone production, but it protects you from skin cancer, breast cancer, uterine cancer, ovarian cancer, and prostate cancer. So there's reasons. And then pregnenolone and DHEA are part of your adrenal hormones that have to do with memory, but they're also the precursors to all your other adrenal hormones. And so quality is an issue that is very important. They did a study, and I know Julie knows this one, of that they found out what people did. And what they looked for was price and the packaging. But that does not mean you're getting quality. And there's a lot of crap out there. So you have to be careful where you get things in it. Are they going to be effective or not? Everybody will try to sell you something. Believe me, I've tried pretty much every snake oil there is personally. And it just doesn't work, you know. So you have to make sure you're getting something that's worthwhile. What does it mean, pharmaceutical grade? That means the grade at which that it's acceptable to the pharmacies to dispense to the public. And that's government regulated. And so it's great to get a pharmaceutical grade supplement if you can. Not all supplements are pharmaceutical grade. And I don't know if you know this, but ginkgo is a great product for brain. And actually, if you have children that are having a little trouble struggling in school, you should be giving them ginkgo because it helps them with their brain. And it also increases blood flow to arms and legs. But the farmers who grow the ginkgo trees could wait till August and harvest them when the leaves are the biggest, and they just dry them and shred them and put in capsules. How well do you think that would work? It won't work at all. You need a company that will extract it in the early spring whenever they're pulling the leaves out. Now, there's no way you can know all this, but you can do your own research. You can ask, people that are knowledgeable and find out. Now, believe me, every MLM company in the world wants you to take their product. They promise you it'll fix everything. Well, we've all been down that road. Auto ship, this is something that we do here. If you don't want to come here all the time to pick up supplements, we will ship them to you. And you can put it on auto ship where it comes at monthly or 3-monthly intervals so that you can just automatically have it at your house. So that's something that we've started doing. And you can do it online or you can do it, call us. Either way is fine. The high quality multivitamins have to do with many, many things. There's many things in there. And so all these things in here, and it's in your handout, talk about, all the things that can be added to these things that you don't want in your multivitamin. You want it to be clean. You want the products to be absorbable. You want them to actually be active molecules. LifePak Nano is the multivitamin I take. It includes my omega-3s. It's such, this is made by a company called Pharmanex, and they're really high quality. And I've been taking this line of products for 20 years. There's all different LifePak products. This one, nano, it's nano for a reason. It means the particle size is nanoparticles. That means it's super absorbed. Sometimes the particles are too big and they don't really get absorbed into your bloodstream. These are very tiny particles and they do get absorbed. Like for vitamin E, they have the not only the alpha tocopherol but the beta delta and gamma tocotrienols, that's part of vitamin A, that are really important. Delta tocotrienol is a product we carry here separately, that if you have cancer issues, this is something very important that you will want to take. So, because it kills cancer stem cells, so you won't have metastatic disease. So there's lots of things that come with taking these things. Now, why would you take a multivitamin? Well, because if you took every ingredient out of here and took it separately, you'd go broke. You can't, I mean, you can do that, but you would really go broke, and you would be taking so many pills you couldn't handle it. Now, this is a packet of 5 capsules of the multivitamin and 2 omega-3s, and you take it twice a day. So that's 14 pills a day that are just my multivitamin and my omega-3s. But, but again, you can't have it as one tablet. It would be this big. You can't do that. So this is what we talk about when we do this. Now, age-like vitality. Okay, I've got this book here. This product has been out several years. I started taking it immediately. Are y'all familiar with the term epigenetics? Okay, for those who don't, it means that you can turn genes on and off. It's not that you were born with a problem, that they get turned off or they get turned on, and it's a problem. Now, this company interacted with the genetics company that can study the human genome. And what they did was they found the youth gene clusters for this product, Vitality. And the youth gene clusters, then they could see what a 20-year-old looked like and what a 40-year-old looked like. And then could they give them something and change that expression? Now, this is hard for you to see, but this is the expression of a 20-year-old. By 40, it's basically reversed, totally. Reversed. And then after about 3 months of this supplement, it went back to the 20-year-old expression. That's what you're looking for. Now, this works in 3 areas and 3 areas basically only, but they're very critical areas. The cordyceps sinensis is helpful with your heart and lungs, and it really helps increase their capacity to function correctly. The pomegranate extract is one of the best things in the world we know to help supercharge your immune system. If somebody you know has MRSA, do y'all know what MRSA is? And they say, the doctor said they can't get rid of it. Oh, I can get rid of it. You just give them their antibiotics and you give them pomegranate juice twice a day, and you get rid of the MRSA because you just need to boost the immune system. Pomegranate extract, so boost the immune system. And panic ginseng boosts your adrenal glands. And if you know the lab we do here, a lot of adrenal stuff we're dealing with here. So now, that, like I said, it doesn't fix everything. It's not going to make your hair grow, and it's not going to do certain other things. But it certainly resets those youth gene clusters. Age Lock Youth is another product made, and the Age Lock is this particular company's thing that has to do with resetting the genes for epigenetics. This one has all of the products from around the world, the indigenous tribes, that they use for anti-aging. And so all those are combined into one product. And it actually includes your omega-3, so you would not have to take that in addition to this. But it has all these things at pretty high levels. And resveratrol, there's so many things in here. But it has these extra things that push you to a new level. Okay, so, but that's the indigenous tribes from around the world. Okay. They also make a product called ProBio-PCC. Now, this has an interesting story. I'm a story guy. If anybody that's come to see me, y'all know me, I tell stories. So there was this Swedish company that sent their employees all around the world. And they had one lady in the group that never got Turista. All the rest of them got traveler's diarrhea, but she never did. And it was so amazing, they decided to study her. So when they studied her, they found out that she had this very particular probiotic in her gut, Lactobacillus fermentans. It's highly aggressive, it highly coats the intestinal tract, and it particularly likes the Peyer's patches where your immune system is in your gut. And so when I have somebody come in, their guts are really messed up, this will really fix them up. It'll clean them up, get them back on track, and they'll say, oh, that was great, Dr. Spurlock. But it's not your typical probiotic. We carry 3 probiotics here. And I actually believe in rotating them periodically so you can get different species in your system. But this is a really, hit it. But most people, you've never even heard of this one. But that's what this one is. And, it really rarely has side effects of any kind. Megaspore is another one we take. And this one you've heard mostly of Lactobacillus species. This is just a bacillus species. And and it's some set that's not found in most regular probiotics. And so rotating it helps strengthen your gut. We have a lot of tests we order for this, GI effects and all kinds of things that detect what your load is in your system. And you just want to make sure you have plenty of stuff, especially if you're taking antibiotics or other things that might affect it. But sometimes a lot of our patients have a compromised immune system, and they have a trouble fighting off bad things that come in their body, and they sort of accumulating in the gut. You want something to fight back with. Nighttime formula. This is a basic product for sleep, and it has melatonin, L-theanine, which is from tea leaves, passion flower extract, and chamomile. And so the point with that is that it's not a real high dose of melatonin, like 1.5 milligrams. Okay, well, most of us here, we need to take 3. Well, you can take up to 21. I don't know if you know that, but you can. But this is just a simple thing. Now, I'll tell you a funny story about this. I used to go to bed at night, and I'd read for about an hour. Well, I decided, well, I just need to have better sleep. I want more productive sleep, more restorative sleep, so I decided to start taking this product. Well, I'd wake up at 2 in the morning with the book on the floor and the lights still on because I had just passed out. Now, it's no guarantee for some of you that have severe insomnia, but again, I don't read in bed anymore. Let me just put it that way. MHHNS, this is really strange. It has only one ingredient in it, horsetail. It has another benefit too, but this is it for varicose veins. But it helps in combination with gelatin. Now, that's real important. Yeah, gelatin, Jell-O, Knox gelatin. The building block for hair is gelatin, okay? Not collagen. That's for your tendons. Gelatin. Now, there's all kinds of ways of getting it. If you come and you watch me eat lunch, anybody that works here knows I eat a little tub of Jell-O every day. I do. But you don't have to get the dyes and the sugars if you don't want to. You can make your own. My mother makes her own. I started her back in January, and she's grown 6 inches of hair back all over her whole head. But I've got her on a combination product, but anyway, but this is healthy hair, nail, and skin, so it says HNS. Horsetail is a plant that provides a lot of silica, and it's really part of what we need to grow that back with, okay? But in combination with gelatin, okay? Now, cartilage formula. This has a lot of things in it you know about. I was just taking plain turmeric with black pepper, but I added this one in because it has the things that actually help repair, not just an anti-inflammatory. And so the glucosamine, extra vitamin C, the turmeric, the quercetin. Quercetin is a really great product for so many things. It's hard to explain that one. Boswellia for inflammation, rutin, and zinc. Zinc is your mineral for healing. If you need to heal after surgery, you need zinc. Make sure you have plenty. Don't overdo them, though. That's the trick that we need to make sure you understand. Pregnenolone. This is something that is the precursor hormone to all your adrenal hormones. It's called the mother of your adrenal hormones, but it is for short-term memory. Remember, we talked about Alzheimer's earlier, so this is one. Now, most people over 40 will start needing this because your body just starts not making it as much anymore, and that begins that eventual process where it disappears. Now, can everyone take these things? Not necessarily, but you take, with thyroid hormone, you convert cholesterol into pregnenolone. Now, this is just a simpler way to do that, but usually when we give people thyroid, it will help lower their cholesterol and they'll make more pregnenolone naturally. But a lot of us can take this, and it's simple and easy to take. But it actually is a cascade effect. It makes cortisol, DHEA, and progesterone in that adrenal cascade, and so it helps us reestablish our patients with this stuff. But it's great for short-term memory. Now, we're going to get to this next one, DHEA. In my 40s, before we had cell phones, you had to remember phone numbers. And I got to a place where I could not remember the phone numbers. And I go, I have a photographic memory. What is wrong with me? I can't remember this phone number. I went on this back then, and within a month, my memory was totally back. So this is important to have these, these hormones in your head. Now, when I say, a lot of people say hormones, they think of estrogen and progesterone, maybe testosterone. But we have 80 hormones in our body. But these are over the counter. And these really work well for you. But again, we're scientists here at this office, and we like to do lab work, and we like to see where your levels are. And I want to know if it's too high or too low, and I want you to tell me how you feel on it. We're going to make adjustments on that. D3. This is really not a vitamin. This is called a prohormone, and you should always think about it. This is one of those 4 pillars. And vitamin D3 is, you get it from the sunshine. You actually get it from just sunshine in your eyes if you want to know the truth. But we have such a greater need today than we've had in the past that you're going to have to supplement it now. There are 200 different receptors in the body. We know 3 things it does. It, hang on. Well, hang on, I'll skip that, back up. Depression, and if you live in Seattle and you have seasonal affective disorder, you need a sun lamp in your workplace and where you live, and you need to take a supplement. Osteoporosis is critical. Think of vitamin D3 as the hotel doorman that lets you in the house with your calcium. It puts it into the hotel. The vitamin K2 is the bellboy that takes it to the right room. Okay? So that's why you need both. And you can sometimes get it with both in it, and so it varies on person to person. Again, remember, don't overdo things, but a lot of doctors don't give you enough. And most multivitamins don't have enough to get your levels up. I like to keep vitamin D3 between 80 and 110. That's the optimal levels to prevent cancer. So, again, so it helps boost your immune system. But it's really a critical product. Now, there's a lot of weird products out on the market. Be sure you're getting D3, not D2. Most of the patients that we see here cannot convert D2 to D3, and so they're just wasting their money. Most doctors know the difference. Magnesium glycinate. There are many magnesiums. They all need to be attached to amino acid because the amino acid helps you absorb it. Without amino acid, if you take magnesium chloride, it's probably not going to help you very much in your body because you're not going to absorb it. You need it to be an amino acid. Glycine is the one that's on this one, and it is actually the amino acid that helps us with sleep. But all magnesiums relax muscles. I particularly have muscle cramps in my calves, especially at night. And I had to go on magnesium several years ago because it was so bad it would wake me up. And I've had to adjust the dosage over the years. But it helps you with all your muscles. So the skeletal muscles, what I was talking about, the GI tract. So if you overdose on magnesium, what do you think will happen to you? Diarrhea. That's how you know to back off. And then it helps relax the muscles in your blood vessels we call smooth muscles, and that will help lower your blood pressure. So it has lots of things. So there's magnesium taurate, magnesium malate, magnesium aspartate, magnesium threonate. Yes, sir?
Well, I was just going to say that there's so many types of magnesium that it's a little confusing, so they tell you one is better for one thing, one's better than something else. Like I take 2 of these every day, but then I take that magnesium taurate, or they say it's better for your brain.
Threonate? Is it threonate? Is it taurate?
Well, it's the one they call life extension called the Neuromax.
Well, that's what I'm saying. I mean, glycine is actually neuromag too because it's working on your brain. But it depends on what you want to achieve. The magnesium itself still does its regular job. It relaxes muscles, no matter which one you take. You just need to absorb it. The amino acid it's attached to, it does the extra benefits. So like I said, for muscles, if you wanted to just focus on muscles, you would do, like we do with fibromyalgia patients, you might want to use magnesium malate. If you have constipation, you might want magnesium citrate. If you want, the taurate is for high blood pressure, mostly. So there's all these different kinds you can take, and it doesn't matter, you can switch around. But again, this is the one we carry here, but there's a bunch of different ones. We have a lot of sleep problems with our patients here is why we do that. Now, iodine. What you really ought to take is an iodine-iodide combination. You really rarely ever need more than 12.5 milligrams. You can overdose on iodine. Do not take too much of it. But it is something that's very important. And I told you the things it helps with. So with me, I went up to a certain level of my thyroid medicine, and over a period of time, I was able to come way down on the dose because I think the selenium and the iodine I took allowed me to make more of my own thyroid hormone. I didn't need to take as much of the product anymore. So it allows us to take less. But it's good for you, and again, but you don't need too much. There are possibilities of measuring blood levels. They're not real accurate, so we don't do them frequently. Oh, I'm going to go back. Okay. You can, and it will help your body work with it better, but because it also has the ability to prevent skin cancer and prostate cancer, it's also beneficial for you in other areas. But you do not take them at the same time because it's a heavy mineral, and it will bind up your thyroid and it won't be usable. So I take my thyroid in the morning, I take my iodine at night. But it did help me lower my doses of thyroid over the years. Well, I missed this. The T3, I want to say something. I talked to you a lot about T3 and reverse T3, and those are mirror images, but iodo, it's 3 atoms of iodine with this amino acid, L-thyrronine. And so reverse T3 is triiodo D-thyrronine, which is the mirror image of it, and it fits in the receptor site and it does nothing. And so a lot of the doctors don't even know what I'm talking about, but this is something that we see very frequently in our clinic. And you want to make sure that when you're building and making your own iodine, your thyroid molecules, you need to have enough of the ingredients to make it with. I eat a lot of seafood. I wouldn't really encourage you to do that because you're probably going to get mercury poisoning. But the point is that that's where a lot of the iodine comes from in natural life, is from seafood. A lot of people don't like seafood, so they're going to be sort of low. Epicor. I learned about this. This is a very interesting story. This one is not necessarily for everybody, but for the line of work I'm in, if you're an elementary school teacher, if you work at a hospital, this may be something you might want to take. Now, this is an issue that there was, the story is there was a company that was using this supplement in their animal feed. And the insurance agent for that company went to them and says, "What's wrong with y'all?" And they said, "What do you mean? You never use up all your insurance money. You always have money left over every year. How are y'all doing that?" And they said, "Well, we don't know what you're talking about." And says, "Well," and they started checking. It wasn't the office staff. It was the people on the line that were never going to the doctor. And they had already figured out that that supplement that they were putting in the animal feed was helping them not ever get sick. And they took it home and were giving it to their families. So this is a Saccharomyces fermentate. It's a yeast fermentate. And what does it? Supercharges your immune system. So if you get exposed to bugs, you won't pick them up very often. You can still get sick, but you'd have to have a pretty big exposure. This prevents a lot of it. As soon as I went to this lecture, I immediately ordered it, and I started taking it immediately. And so it really is helpful, especially if you have problems picking up infections too easily. This is something that you might want to take. This is amino acid protocol, and there's actually, I'm going to go over just the products first, but I'm going to draw you something on the board I want you to understand. So this removes plaque arteries, increased signaling arteries, and it works best with nitric oxide being present. So there's several things here. This is not for necessarily young people. This is for us over 50 people. But I'm not going to tell you the full story of how I found out about this, but this information is from a Nobel Prize laureate in medicine, Dr. Louis Ignarro, and he has a very big recommendation of using these levels to achieve the functioning of your blood vessels in your body. And so we'll talk about in a little bit about endothelium. But so arginine and citrulline are one part of it. Taurine is another part of it. And then we'll talk about nitric oxide later, but let me show y'all something. Okay, so in your arteries, yeah, that one ain't working. Well, okay. Let's try another one. Yeah. We call this the lumen of your artery, the center part. Inside is this a little small level of cells that's called the endothelium. And it's the biggest organ in your body. And it does a lot of signaling. And so inside this endothelium, there are receptor cells that signal things. Okay, and so they may be like every so often you'll have a receptor. And so they're here and they detect things. If the arteries need to be opened up, if they need to be shut, we call that, dilation and, and open up. But they're every so often. Okay, so that's the inside of your artery or your vein, but mostly artery. So this is that blood vessel. Now, we all know that we get plaque, right? Cholesterol is not the real problem. They tell you it is, but it's not. But that plaque isn't smooth and clean. It's irregular. So you get a little bit here, a little bit here. It just starts developing over the years. They have found plaque in 10-year-olds. When they did the autopsies on the soldiers from the Korean War, the 25-year-olds already had fairly large plaque already. And there's a lot of issues here. But like I said, it starts building up over time. And it makes the lumen of this smaller. Okay? Now the issue is that what's happening to those receptor sites? They're covered over so they don't work anymore, so the things don't react to the stimuli like they're supposed to. So, and it just gets worse and worse over time if you're not correcting this, and so it creates all these problems. And so it gets thicker and thicker. Now, at some point, some of these may get really big. You see that the lumen here was big, but it's down to this, and you have a clot float through, what's going to happen? But that's not the real problem. This is irregular tissue, and that irregular tissue gets bacteria, funguses, viruses, parasites inside of it, and it gets inside there. Well, they don't have their own blood supply, so they just sort of fester in there, and they eventually form something like a pimple, and it burst. The platelets, that's why I ask you to take aspirin sometimes, they come in there because they don't like the arterial wall being torn, so they try to fix it real quick, and they completely block the artery. That is not cool. Okay, that is what we're seeing with people, okay? Now again, this stuff, but see, if you're trying to get nutrients through this tissue, how effective are you when you get it through this tissue? Do you see what I'm saying? You're not getting nutrients to your tissues. So I have two cardiologists I treat with this, and they both had, not cardiologists, two doctors, they both had dysrhythmias. When I treated them with it, they quit having the dysrhythmia because now you're getting nutrients and oxygen to the nerve, and it stops misbehaving. It's really not rocket science, but that's what we're talking about. So you want this to all be working, and you don't want much plaque because you want those arteries to be signaling. And those amino acids really help with the signaling, really help with that. And so, but this issue is that there's a book about this called New Heart Health by Dr. Ignaro, and he did 40 years of research on nitric oxide therapy, but again, you have to understand that nitric oxide is critical for signaling in those arteries. Yes, sir?
Doctor, that bottle in that picture, it says take it on an empty stomach, but it sounds like after what you're saying, maybe you're better off taking it after you have a glass of tea.
No, that's not important. That's not important. They have nothing to do with the absorption of each other. Just take them the same day. They don't have to be at the same time. You can take them at the same time, but it doesn't matter. No, the beat, that's a separate issue. We're going to cover that in a minute. This is the signaling, and then the receptor sites do interact with nitric oxide. And nitric oxide helps your whole body because your blood vessels go through your whole body. I'm going to get to that thing probably at the end, so just bear with me. Oxbile. I take it. I had my gallbladder removed a year and a half ago. I didn't want it removed, but unfortunately, I had no choice. So here we are. Well, I've been a doctor for a very long time, and I thought I was taking good care of my gallbladder patients that had them removed. I wasn't. I started having all kinds of issues. I go, this is not acceptable. And I had to figure out what it was. You know, I looked all over Dallas and couldn't find Oxbile anywhere. Whole Foods, Central Market, all these places, nobody had it. So I went and ordered it immediately online from Amazon, of course, and then we got it here at the office. But this is not just ox bile, it is also digestive enzymes. But I talked about, you know, a while ago that for the fat-soluble vitamins and for your omega-3s and your avocado and your butter and all that stuff, and your brain runs on fat, you need to absorb it. Without bile, you will not absorb it. Your gallbladder pumps out bile when you eat a meal. So you don't put this in your pill box. You put it wherever you're going to be eating. So I have a little bottle on my desk after lunch, and I have it at the house right where I eat so that I will see it and remember to take it with that meal. Okay? But it has a lot of stuff. Now I'm going to be a little gross right now, but the symptoms of a person who's had their gallbladder removed and they're having problems not absorbing their fat, they will have these three symptoms. Their stools will not be the right color brown. They will be lighter colored. They'll be tan. They'll be orange. They'll be these unusual colors. Maybe not all the time, but they'll be there. That's how you know. One, your stools will be soft-served texture. They won't be hard and formed. Soft-served texture. And you will have a very foul gas that you produce, because when fat rots at body temperature, because you didn't absorb it, it makes a very unpleasant gas. When you take this, that all goes back to normal. but you have to take it with each meal. That's it. Now, I'm also thinking about running some studies on some of my patients because they still have their gallbladder, but it doesn't appear that it's working. And Julie, when I wasn't responding to the scanner correctly, I think my gallbladder had quit working a couple of years before I had to have it removed. It just quit working. So I think that that is a reason why the scanner doesn't always show what you're doing, because you may not be absorbing it. The digestive enzymes just help you break down the food. Now, one more thing about bile, I think y'all need to really understand. A big problem in America today is reflux, right? Well, there's a mechanical problem. You know, here is a body, the width of a body, you know, from the side of a supposedly normal person. Here's most of the rest of us. Okay, that fat in there is a mechanical barrier to your stomach expanding. And you can't expand. So where does the excess fluid and liquid and stuff go? Up the esophagus. Okay, so don't eat big meals if you have a big belly, okay? So the next issue is that through the process you chew. So you really shouldn't chew gum unless you're going to eat a meal, because it's still in the stomach. Something's coming, so all the hydrochloric acid starts being produced. You don't want to do that if you have reflux. So you're producing hydrochloric acid. So you chew the saliva and that food goes into your stomach. And this is something about nitric oxide too. I'll get to that later. But it goes in the stomach, it mixes with the hydrochloric acid, and it breaks down everything but fat. Fat does not get broken down in the stomach. It makes the thing we call a chyme. It enters the small intestines through the pyloric sphincter, and that signals the pancreas to pump out insulin and pancrease and lipase and protease and all this stuff to break down the food, and it signals the gallbladder to shoot in some bile to break down your fat. And that's the process. But when that bile gets shot into your small intestines, it closes the sphincter. What if you don't have any bile in there with your meal? It just stays open. So we need that bile to close this sphincter, okay? That's why I'd like to keep my gallbladder, but it didn't work. But anyway, digestive enzymes will help you break down your food. There's some things that help break your food down. Because remember, everything's about absorption. The more you can break the food down into small particles, the better it absorbs. Dehyst. I've been through a whole set of issues with my allergies. And over the years, I have taken the highest level of antihistamine decongestants possible. But of course, I got sleepy and dry mouth. But the Claritin, Zyrtec, and Allegra did not do a thing for me. Nothing. So I couldn't take those. Well, I eventually got to taking shots. And my symptom of I needed a shot was that I woke up with a light headache. And I took a shot, anywhere from 4 to 14 days for my allergies, and then and I knew because I wake up with a light headache. Well, I found out about this product, which has all these problems. Remember I mentioned quercetin before. Stabilizes the mast cells. That's where the histamine comes from, okay? That's what it releases. Stinging nettle balances inflammatory response. It sort of is this issue of where steroids work. Bromelain reduces circulating allergenic proteins. It dissolves the proteins that cause you to have allergies, so it helps take them away. And acetylcysteine reduces thickness of mucus, so it drains better. And then vitamin C deactivates histamine. So you see, it's got like all these things happening at once instead of an antihistamine. Now, the steroids, like the Flonase and stuff, what they do is they stop the tissue from reacting, but that's much like the stinging nettle. And then and so the decongestant just sort of dries up your mucus, but you're not really fixing anything. This one does it all without any of it being harmful to you. So I started taking this twice a day, and I take a little bit of cortisol, and I know a lot of y'all in here probably do too, and I never woke up with another headache. So I had to throw away my shot medicine because it was 4 years old and I'd not touched it in 4 years. So this is what I take. Will it work in every single person? No, but it helps a lot of people. This is the beet supplement, especially for what we call executives because they're too busy to fool with all this stuff. But this is a product that you have to, the beets and dark green leafy vegetables is where nitric oxide comes from. Most of us probably don't eat many beets anymore. I have a Pakistani guy in here the other day, and I was asking him about, how does he eat in America compared to Pakistan? He said, my mother made beets every day. We ate something with beets in it every day. I said, yeah, those mothers did that. We don't do it that in America. But the issues are that this is a beet tablet, okay? And so, but the trick with nitric oxide for it to be made is you must mix the supplying food, which would be a dark green leaf vegetable or beets, with saliva. It must mix with the probiotics on the back of your tongue, and then it goes to the stomach, and it mixes with hydrochloric acid, and that makes nitric oxide. You can't leave parts of that out. If you're taking Prilosec or Nexium, guess what? You don't make hydrochloric acid. Sort of problematic for you to make nitric oxide. So I'm not a big fan of those products. But this thing, now this goes in the system, and it makes everything work together. So the nitric oxide helps with those amino acids that I take to make the whole body work better. Like I said, that book, New Heart Health, talks about all of this. And it talks about actually what we do here at this clinic to get all your hormones in the right place, get your nutrients in the right place, so that all of this works together. So there's some very distinct male sexual benefits from this for your men in the audience and for your husbands and boyfriends and stuff, because it really helps them perform better. It is because that's what Viagra works on, nitric oxide. What if there's no nitric oxide present? It's not going to work. Look, this is the big part of that. And it works for you ladies too, but I'm not going to go into detail on about that right now. Okay, so again, I take all of those because I want those qualities for me. I want my body to have all those things. I want to age slowly. I want to keep my brain. I'd like to keep my hair. I want to take care of my skin. You know, I want all those things for me. I want my body to be working correctly. I will change this over time because I'm doing it. But why did I do this lecture? At the big conference I go to every year, there's this fantastic endocrinologist from Belgium, Dr. Terry Hertog. And we all love him. And he's exactly my same age. And he always gives these fabulous lectures. Now, he's from Europe, so they have things we can't get our hands on right now. Maybe eventually. But he's there, and he gave a lecture one day at lunch about what did he take. And all 6,000 doctors came to that lecture. We wanted to know what he takes. There's a lot of things he takes that I can't get right now. I'm working on some new stuff. You didn't see growth hormone there. I might do that one day. I'm not doing it yet, but I might. We have something to boost growth hormone here called Gamma Grow. But there's all these issues of this is your vehicle. What are you doing to maintain it and make sure it repairs correctly? Now, like I said, I didn't talk about hormones. I take thyroid, T3. I take cortisol, hydrocortisone. I take testosterone. And I take my Valtrex for my Epstein-Barr virus because I want all those fixed. So those are not listed because those are more prescription drugs. But I do take those as part of my particular thing. So the trick is to figure out what it is that your body needs. So I told them at Dr. Williams' lecture that I went to the other day when she spontaneously said, Dr. Spurlock, everything. I told them about the cars and everything. And I said, now, your job is to find you a healthcare practitioner that can measure your repair molecules and replace them appropriately. Dr. Williams knows how to do that. And I think they were going, oh, wow. You know, so the issue was she didn't really tell what she could do. She just said she was a good doctor. Well, what does that mean? You know, well, today I think we have a lot of heavy-duty shoppers for doctors because people are looking. Y'all are used to doing your own research. You're used to learning and how to do things. And so the point here is this, is that like one a day and what's the other product out there? Centrum. Those are crap. They don't even dissolve. They may have all that stuff in there. You don't get any of it. There's a story where they were dredging a river up in New York, and the guys who were dredging noticed this really beautiful white layer, and they went there and looked at it, and it was all Centrum tablets. You can still read the name on the tablet. Okay, so you do not want to take crap. You need to think things. You know, and that's what we're saying. And you have to, like I said, absorption is really important. Quality absorption. Also, when we're using products here, I want to see if the levels are going up. If they're not going up, probably that product isn't working in that person. And so, you know, we have to look at all that. So everybody's different. Everybody has different needs. I have patients taking supplements I don't take because they have specific needs. Like you ladies, I might suggest you take evening primrose oil. I might suggest that you take DIM to help your liver process estrogen correctly. I might suggest several other things that you might need that I, as a male, wouldn't take. But I'm working on 2 or 3 products right now, and I don't know what I'm going to come up with in the next 6 to 12 months. There's going to be some new stuff coming around. I really think I'm on track for figuring out what causes the belly, because I've had a lot of trouble getting that off of me, and I'm mad. And so I'm going to figure that one out. But no one's talked to us about that. But we're going to figure it out. That's our whole purpose of our clinic. We're going to figure it out. Roxana and Amanda are going to help me figure that out. They're doing experiments on their husbands, and we're doing all these kinds of things here. We have a lot of fun. And I had this great thing. I'll just tell you a wild story. This has been a sort of a great week. Just all kinds of wild things have been happening here. But I had this lady come in that I hadn't seen in 4 years. Money became a problem, but right now her business is doing pretty good, so she can afford to see me again. So she's come to see me, and she says, Dr. Spurlock, I have Lyme. I've done all this stuff, and I've really not gotten over it. I'm still pretty much on the couch. So she says, I'm really having trouble. And I read this article about this new study, and they're doing it. Will you do this for me? Well, it's this ancient drug that I've known about my whole career. And I said, sure. It's no big deal. I'll do it. So she came in. We said about it. We looked up on the internet. We checked all the research protocols and what they were doing and what the dosing was and everything. And I said, are you ready to go? And she said, yes, I am. And I wrote it. It's disulfiram. Probably most of you do not know what that is. That is Antabuse. Maybe a lot of you don't know what that is either. That's the drug that you give alcoholics so they don't drink. Now, we've always used it for its side effect. The side effect is if you drink alcohol with it, you throw up. So you give it to them in the morning, and if they drink in the afternoon or evening, they throw up. So it trains them not to drink. Because usually in the morning they don't want any, so you can get them to take it. Well, anyway, but we never knew what the medicine did. We just used it for its side effect. Well, they've discovered, they've already had this, but they're just doing the bigger trials now, is that it really, really eliminates Lyme. An ancient drug that we didn't have any idea what it did, but now we're doing it. We found out, Roxana brought me some information about a specific diuretic that we've used for years for you ladies that have acne problems and too high of a testosterone. It actually deactivates Epstein-Barr virus and stops it from replicating. So we're going to continue to figure out how to make this work for y'all, and if something doesn't work, we're going to have a backup. We're going to constantly do that. But I just want you to understand what I take. And if y'all want to ask me questions afterwards, I'll be glad to. I will tell you one thing I have here today. I have this little strip that I'll ask you to put a little saliva on your finger, and I will test you. And I'll see what your nitric oxide levels are tonight. And then you'll know what you need to do. Because the issue is that it needs to be over here in this dark range, and you don't want to be down here in this light pink range. And I know that what I do, I'm up here. So, that's the issue. I have an attorney that I work with as a patient up here, and he's really funny. I'll go in the exam room, and he's got his yoga mat out, and he's stretching and turning, and he's sweating in the room and all this stuff. And he's really about 70. He's really cool. And I says, now, I had tested him, and it was like through the roof. And I said, well, Whitney, what are you doing? He says, Doc, I put in my smoothie every morning. You don't need to worry about me. I said, okay, fine. But that's the point there, is that you just learn to incorporate. Maybe you just do one or two things, but incorporate slowly. You have to incorporate it into your pocketbook too. But what's the best thing to save for your old age? Yourself. Now, here's the point. If you have all the money in the world and you don't have your health, what do you have? Nothing. If you have your health, you can always make money. Remember that. I also don't ever plan to retire, so y'all can just hang out with me for until the end comes. But I mean, I planned for that to be about 90 years from now. Okay, so so we're going to work on that. I will tell you the exciting thing about our academy that we belong to, and that's that little certificate in the middle right over there. My anti-aging academy we belong to. If any of you have kids are gonna and they'll have their own children in 2025, those children will be able to live to be 200 if they take care of themselves, if we don't poison the world. But I will tell you a lot of the toxins we've been exposed to have caused a lot of our illnesses. That's why you need to make sure you're using your thyroid if necessary to detox. We have a new detox protocols we do here. I just got finished with that. I just got finished with our diet to get the stuff off. I'm now going to probably do the next level to get the rest of this belly off, and we're going to get that all taken care of. But the whole point is that medicine is still in evolution. We don't know everything yet, and y'all don't need to worry about that. We'll take it a step at a time. Roxana and Amanda are trying something I'm not quite comfortable with yet, but I'm letting them do it. And because it sort of challenges my core beliefs, but we're going to see if it works. And because if you don't make change, nothing else ever changes. Remember that. Okay, so I'm going to open up for questions.